In this training session, we'll show you how to create a patient encounter. The physician will log in under their credentials, and as we mentioned in the previous session, you can find a patient's record by typing in the first or last name, date of birth, or patient number in the search field under the EMR menu bar. We'll type in green and click on the magnifying glass icon to begin searching the database. Click on Patient Dwight Green from the search results. If there were multiple patients by the name Green, they would show up under the search results. In this case, there's only one patient with the name Green. You are now on the patient's health record and can now proceed to create a new encounter. Click on the Encounters tab. If Mr. Green were a returning patient, there would be past encounters recorded on his patient record that could be reviewed in the dock at the right. But since Mr. Green is a new patient, there are no past encounters to review. Let's create a new encounter by clicking on the New Encounter button at the bottom left. The encounter is designed to flow easily and capture all the necessary information a physician needs to assess a treatment plan and to complete a detailed claim process with assigned codes ready for immediate billing. At the end of the encounter, the physician is ready to print and send it off for billing purposes. Again, the encounter is a design template that flows easily and requires little typing from the physician or care provider. Common chief complaints are listed on the encounter template. To select a chief complaint, simply click on the complaint and a green circle will appear indicating the complaint was selected for this encounter. A new complaint can be added into the search field by acronym or complete spelling, and a search will find the matching complaint. We'll type in HTN and select hypertensive disorder from the search. It will then dock the complaint aside with the common chief complaints options. The chief complaints selected from this encounter will dock at the bottom in the assessment and plan section. This makes it easy for the physician to create a treatment plan. We will discuss it later in the encounter. Each step in the encounter screen can be collapsed or expanded by clicking on the arrow to the left of each heading to reduce scrolling down to complete the encounter. We'll collapse the chief complaint section since we're done with it for now and move on to the history of present illness. We'll type in the free text field to document reasons for the visit and select elements that are associated with the description. By clicking on the elements in the section, the circled items indicate that each element has been selected and applies to the patient's visit. We'll select quality, timing, duration, context, modifying factors, and associated signs for the notes made below. Elements must be selected so that the appropriate E&M codes can be calculated at the end of each encounter. We'll see how this is important at the end of the session. In the Review of Systems section, we'll go further into the patient's symptoms and document them. By clicking on a symptom once, the symptom is crossed out, indicating that this is not a symptom the patient is currently experiencing. By clicking on the symptom twice, the symptom is circled, indicating that this is a symptom the patient is currently experiencing. A third click will deselect the symptom. Collapse the section and move on to the next step. The Past Medical, Family, and Social History section captures patient history or changes. Conditions not found can be entered in the search field and added to the history options. Click Save and continue on. Once data is input and saved, a user can close the encounter and return to it at any time. For example, a medical assistant may take the family history, medical history, and vitals, save and close the encounter. The physician can open the encounter in progress and complete it. Continue on with the physical exam section. We'll just add some sample data to finish the section. The chief complaints selected earlier in the encounter are now docked in the assessment and plan section. The physician can fill out a medical treatment plan for the patient's diabetes and hypertensive disorder. By clicking on the plus icon, a physician can make a diagnosis, write up the procedure performed, request a laboratory test, prescribe medication or a device, refer a patient to a specialist, and add other recommendations. We'll add additional comments in the Counseling and Coordination of Care section and additional section. In this instance, we suggest the patient continue current medications and recommend a follow-up visit in a few weeks. The Assign Codes section lays out the summary of the required components and contribution factors in the E&M code calculation. When we click on the Evaluate Code button, the system looks at the documentation above and determines the level of complexity for the history and exam. In this final component, the physician needs to select the level of complexity of his treatment plan. The system will then calculate the E&M code and automatically recommend codes for this encounter. The physician can 1. Keep the recommended codes, 2. Provide additional documentation and reevaluate the code for higher coding level, or 3. Manually select something else. At the end of this encounter, click on the Complete Encounter button. The encounter will be saved in the patient's record and is now available for direct billing. The medications that have been prescribed can also be found in the patient record under the Medications tab. We'll print the prescription for the patient.